Good afternoon, everyone. On behalf of NASH 24/7, I welcome you to our public awareness program on Let's Fight Against Fatty Liver. NASH 24/7 aspires to bring best in class education and awareness program to serve healthcare workers, patients, and their caregivers. Today, we have a renowned gastroenterologist from Delhi, Dr. Vibhu Mittal. We need no introduction, however, I would fail my duty if I don't mention that. Dr. Vibhu is a leading gastroenterologist in Delhi, providing comprehensive and compassionate care to many patients for various gastrointestinal and liver conditions. He has experience building a clinical skill set that allows him to deliver patient-centric care. He is currently associated with Max Super Specialty Hospital, Delhi, as a senior gastroenterologist. So, sir, we salute your dedication towards spreading awareness related to liver health. So now I invite Dr. Mittal to enlighten us on the topic. Over to you, sir.
Thank you, Mr. Lakhan, for this opportunity and nice introduction. Well, friends, as Mr. Lakhan has already mentioned, I'm Dr. Vibhu Mittal, working as director and senior consultant gastroenterology and unit head at Max Hospital, Patparganj, Delhi. The topic today is fatty liver, and I think most of you would agree that it is one of the burning problems in our society. Not just as doctors, but even as a general population, there are lots of people who come to us with simply a report, carrying a report of fatty liver without any other symptoms also. So this is rampant. So today we'll first understand in simple language about what is liver, what does fat in the liver means, how can that cause problems to us presently or in future. So let's start with what is liver. Well, it is the second largest organs of the human body, and many of you would be aware that it is there in the right upper quadrant of our abdomen. पेट के ऊपर वाले हिस्से में सीधे हाथ पे liver होता है, and it weighs roughly in an adult to around 1.5 kgs, with less than 5% of being fat. So fat is there in the liver normally also, but the amount of fat in the liver normally is less than 5% of the liver volume. Normally it is pinkish brown in color, soft consistency, and is highly vascular organ. What are the functions of liver? Well, heart does a very important function of pumping blood. Brain is our master organ. It controls everything. Liver is like an industry to our body. There is no single function of liver. It is involved in at least hundreds of reactions and processes in the liver. So let's enumerate few of them. It destroys old RBCs. The old RBCs, after being destroyed, form from the bowel. It reaches the liver, and where nutrients are processed. After this, it regulates the blood composition. It produces protein and cholesterol. As I said, it is responsible for more hundreds of metabolic processes. It is also responsible for breaking down alcohol and many other medications which we advertently or inadvertently take. So it acts as detoxification of our blood. Then it produces bile, and this bile, which has important functions in terms of it acts as a messenger to detoxify our body, as well as it has compounds which are necessary for absorption of food. So it is a vital part of many processes in the body. Now, what is non-alcoholic fatty liver disease, which is now also known as metabolic associated fatty liver disease? It is a condition in which fat content in the liver increases. So normally, as I said, the fat content in the liver is around 5% of the weight of the liver. If it increases beyond 5%, this becomes fatty liver, commonly known as fatty liver, and technically referred as a non-alcoholic fatty liver disease or metabolically associated fatty liver disease. Other reason for fat in the liver, common other reason for fat in the liver is alcohol. So alcohol and fat without alcohol, which is NAFLD, are two important reasons of fatty liver. Now, if there is fat in the liver in a significant percentage of population, this will cause liver damage. If there is excess fat in your body, it would be preferentially deposited in the liver. So being overweight or obese, having type 2 diabetes, high cholesterol are factors which causes increased chances of fatty liver. Is it common? It is very common and is progressively increasing over last few decades. As per some estimation, and these estimates are around 10 years back now, 1 out of 4 people have NAFLD regardless of weight. This is global data. If there are 100 people in the world, 25 would have NAFLD. And if we talk about diabetics, then 6 out of 10 diabetics and 9 out of 10 obese individuals have NAFLD. Once you have fat in the liver, there are high chances of it progressing to fibrosis or hard liver, and a male individual is more likely to progress into a hard liver or NASH or fibrosis. So this is how it goes. Healthy liver, first there would be deposition of fat in the liver, which is known as fatty liver. Now this stage is reversible. So your fatty liver may get back to healthy liver with certain things which we'll talk about later in our presentation. And then fatty liver, if it persists and there is associated inflammation, there are damage to the liver, it starts forming fibrosis. Now we can understand fibrosis as because of repeated damage in the liver, there is a body also tries to regenerate and take care of the damage. This process results in development of fibrosis. Fibrosis is a scar tissue which is formed. जैसे अगर हमारे सर्जरी होता है, कहीं घाव लगता है, तो घाव के बाद जो स्कार बनता है, that is fibrosis in the liver. So healing का जो impact है वो fibrosis है. जब ये process बार बार चलता रहता है over long period of time, this fibrosis increases and the liver becomes we call it then cirrhotic liver. The scar tissue would destroy the liver cells. Liver would then be unable to work properly. In colloquial term, I will say that liver सख्त हो जाता है. So what are the differences between what is fatty liver and what is NASH? Fatty liver is everything where there is fat in the liver. So a subpopulation of individuals who have fat in the liver would have inflammation in the liver. This fat would cause damage to the liver cells. So first stage is there is only fat. There is no damage to the liver. The second would be there is now damage to the liver in the form of inflammation. So the liver cells, the cells which perform important functions would be damaged. And then this damage would result in regeneration and fibrosis. And this process is NASH or MASH now, non-alcoholic steatohepatitis. Inflammation and scarring, if present in association to fat accumulation, is NASH. Now, who are we said every fourth individual adult is having fatty liver. So, who are more likely to have fatty liver? So, definitely, if you have excess fat in your body, the chances of this being deposited in the liver is also more likely. So, individuals who are obese, we define obesity to some extent with the body mass index and body mass index of more than 25, which is your weight divided by your height in meter square. If this is more than 25, this is obesity. For Indians, the value is not, the cutoff value is not taken as 25, but it is taken as 23.5. So anybody who has obesity is more likely to have fatty liver also. Obviously, what kind of food you take, if your food is calorie rich and on top of that also carbohydrate rich, fructose rich, it is more likely to lead to fatty liver. Being exposed to certain medications such as steroids, Alcohol is also part of that. Physical inactivity. If your diet is the overall intake and the activity, there is overall excess calorie intake, then this would lead to fatty liver. On top of it, there are two other things. So one is genetic background, another is metabolic syndrome. Even if the individual has is normal weight or is not extremely obese, but if this individual has metabolic syndrome, which is talked about as diabetes or pre-diabetes, hypertension, central obesity, hypertriglyceridemia, etc., cholesterol levels, etc. So such individuals, even with ideal weight or not so obese situation, are also likely to have fatty liver. And then comes genetic background, which is extremely important in all these processes. This is the reason, the genetic background, why two different individuals of same weight and BMI would behave differently. So there might be one of your friend who is probably 90 kgs with a BMI of 29, with all unhealthy lifestyle, but that individual has very good genetics and does not develop fatty liver, neither does he or she develop advanced liver disease. While somebody who may have good habits, but slightly compromised genes would have high chances of developing all this. But then we cannot control genes. We need to control all the other things. So we need to control obesity, food intake, activities, metabolic syndrome, etc. So I have already talked on this. Being obese or overweight causes fat to accumulate in the liver and increases the amount of fat to more than 5%, leads to NASH. There is another component of fatty liver, is that if there is excess fat in the body, this means if there is fat on the liver, this means there is excess fat on the body. So even if there is no NASH or inflammation or scarring in the liver, if an individual has excess fat, he has more chances of developing diseases related to excess fat. And the most common disease of excess fat is cardiovascular disease, your heart problems, developing heart attacks and myocardial infarctions, etc. Second is there are some cancers now which have been shown to be associated with obesity and hence fatty liver. So cancers of colon, breast, pancreas, esophagus are more likely to develop if the individual has fatty liver. And then obviously there is development of possibility of development of advanced liver disease and liver failure with fatty liver. So fatty liver not only causes more chances of liver going bad, it is also associated with increased cardiovascular, which is heart and stroke related mortality or death, and cancer related issues also. With diabetes, yes, it is bidirectional. So an individual who has fatty liver and diabetes is more likely to have inflammation also. So these patients would have more chances of developing cirrhosis and die of cirrhosis. Moreover, in NAFLD also, the chances of developing diabetes is higher. So are there any symptoms of fatty liver? Unfortunately, no. Fatty liver has no symptoms. And even if there are symptoms, they are usually non-specific, such as mild fatigue, discomfort, or pain in right upper abdomen. It is only when liver damage has progressed to cirrhosis and liver failure, etc., that the individual would develop symptoms of fatigue, nausea. Then there would be accumulation of fluid in the abdomen known as ascites, may develop jaundice, swelling feet, bleeding, etc. So in initial portions, fatty liver has no symptoms. We also tend to see a lot of patients who would come with an ultrasound report of fatty liver and complaints, variety of complaints, like they would say they have gastritis, they have reflux, खाने के बाद भारीपन रहता है, stools में problem है, etc., etc. To them, my simple explanation and answers are that it is not that fatty liver is causing these symptoms. Fatty liver is just an ultrasound finding which we have picked up. At present, it is not causing you symptoms. Symptoms would develop only when fatty liver would progress to cirrhosis, etc. The present symptoms are not associated with fatty liver. So can we diagnose fatty liver? Yeah, we can diagnose fatty liver. The most important thing by which we can diagnose fatty liver is the radiology, the ultrasound. And then there are blood tests which would help us to understand whether this fatty liver is also causing some problems to my liver, or it is just their simple accumulation in the liver. In certain cases, we might need for a biopsy for pathology and X-ray, CT, MRI, etc. I like to stress here, we tend to get a lot of routine blood tests, the health packages, etc., which does have liver function test in it. So LFT has a lot of values in it. The two important values which I like to stress with the general population here is SGOT and SGPT. जो LFT के अंदर SGOT, SGPT या जिसको ALT भी बोलते हैं, ये जो वैल्यू होती है, ये हमारे लिवर के लिए, चाहे वो फैटी लिवर हो चाहे कोई भी कारण हो, ये उसका बैरोमीटर है. अगर हमारा SGPT बॉर्डर लाइन भी गड़बड़ है, बढ़ा हुआ है ना, तो हमें इसको आगे इवेलुएट करना चाहिए, इसको देखना चाहिए, इसको ऐसे नहीं छोड़ना चाहिए. खासकर अगर ये लगातार बढ़ा रहता है. एक सिचुएशन तो होगी जहाँ पे SGPT या ALT 200, 300, 400, 500, 1000 है, वहाँ पे पेशेंट को सिम्टम्स होंगे, वो अपने आप डॉक्टर के पास जाएगा. वो पेशेंट्स मिस नहीं होते. ज्यादातर प्रॉब्लम होती है जहाँ SGPT हमारा 40, 45, 50, 60 चल रहा है. आजकल हम SGPT 30 से नीचे नॉर्मल मानते हैं. तो अगर किसी का 40, 45, 50 भी चल रहा है तो उसके लिवर पे सूजन चल रही है. अगर लिवर पे सूजन चल रही है तो आगे चलकर कुछ सालों में लिवर सख्त हो जाएगा, जिसको हम फाइब्रोसिस बोलते हैं. फिर लिवर पूरा हार्ड हो जाएगा, जिसको सिरोसिस बोलते हैं. और फिर वो लिवर फेल हो जाएगा. तो ये एक मार्कर है जो हमें बताता है कि नहीं, लिवर नीड्स अटेंशन, इट नीड्स टू बी सीन व्हाई दिस इज बिहेविंग लाइक दिस, एंड इफ वी कैन टेक केयर ऑफ दैट अंडरलाइंग कॉज, वी कैन प्रिवेंट फर्दर डैमेज. सो अगर किसी का SGPT नॉर्मल है, इसका ये मतलब नहीं फैटी लिवर नहीं है. फैटी लिवर के साथ SGPT बड़े होने का मतलब है कि साथ में इन्फ्लेमेशन है, यानी कि there is damage also going on to liver. As I said, one is only fatty liver, which is fat in the liver. Then there is damage in the liver in the form of inflammation and scarring. There are also various combination of tests available which can tell you in the blood only, which can tell you along with certain variables such as age or your BMI, whether you have advanced liver damage or not. Now, this is an important test. Again, जैसे रूटीन हेल्थ चेकअप्स में LFT होता है, वैसे ही अल्ट्रासाउंड आजकल काफी जगह अवेलेबल है और काफी वजहों से किया जाता है. शायद पेट में दर्द के लिए, गैस्ट्राइटिस के लिए, प्रेगनेंसी में, एक्सेट्रा एक्सेट्रा एक्सेट्रा. और काफी दफा हम अल्ट्रासाउंड में फैटी लिवर की इंसिडेंटल रिपोर्ट देखते हैं. इंसिडेंटल से मतलब हुआ आपने कराया किसी वजह से था, पर साथ में हमें फैटी लिवर भी पता चला. अल्ट्रासाउंड का फायदा है, इजीली अवेलेबल है, बहुत ज्यादा कॉस्टली नहीं है, और इसीलिए सबसे ज्यादा डायग्नोसिस हमें अल्ट्रासाउंड से ही मिलते हैं. हालांकि अल्ट्रासाउंड अर्ली डिटेक्शन नहीं करता, तो बहुत अर्ली फैट डिटेक्शन उस पर नहीं होता. प्लस साथ में अल्ट्रासाउंड पे हम ये नहीं बता सकते कि लिवर पे सिर्फ फैट ही है या फाइब्रोसिस शुरू हो गया है. एक और क्वेश्चन हमें अपने क्लिनिकल प्रैक्टिस में मिलता है कि पेशेंट्स आर रियली वरीड अबाउट, अभी अल्ट्रासाउंड ग्रेड 2 दिखा रहा है, ग्रेड 1 दिखा रहा है, तो अल्ट्रासाउंड की ऑब्जेक्टिविटी इस मामले में कम है. ठीक है. सो अल्ट्रासाउंड ग्रेड 1 दिखा रहा है, ग्रेड 2 दिखा रहा है या ग्रेड 3 फैट दिखा रहा है, इससे इमीडिएटली लॉन्ग टर्म प्रोग्नोसिस पे कोई विशेष असर नहीं पड़ेगा. अल्ट्रासाउंड ने फैट दिखाया, उसके बाद हमें देखना है लिवर में स्थिति कैसी है, SGPT कैसा है, लिवर हार्ड तो नहीं हो रहा है, और बाकी पैरामीटर्स ब्लड के जैसे ब्लड शुगर, कोलेस्ट्रॉल, ब्लड प्रेशर, ये सब कैसे हैं, वजन कितना है, इन सब चीजों को कंट्रोल करने पे ज्यादा ध्यान देना. एक बहुत ही अच्छा टेस्ट है, आपने नाम सुना होगा फाइब्रोस्कैन के नाम से. इसका टेक्निकल नाम ट्रांजिएंट इलास्टोग्राफी है. ये मशीन्स की अवेलेबिलिटी भी धीरे धीरे बढ़ती जा रही है. इजीली डन टेस्ट है. नॉन इन्वेजिव है, और ये हमें बता सकता है कि जो 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 पेशेंट है उसको फैट के अलावा उसका लिवर हार्ड होना तो नहीं शुरू हुआ है ना, उसको फाइब्रोसिस है कि नहीं है। ना दिस फाइब्रोसिस इज इम्पोर्टेंट फॉर अस। अगर फाइब्रोसिस है तो लिवर रिलेटेड प्रॉब्लम्स जैसे लिवर फेलियर, लिवर कैंसर, लिवर रिलेटेड डेथ, नीड फॉर ट्रांसप्लांटेशन, ये सब आने वाला है। अगर फाइब्रोसिस नहीं है, हाँ, तो अभी लिवर पे डैमेज नहीं हो रहा है, वी नीड टू ओनली वर्क ऑन दी फैट। अगर फाइब्रोसिस है तो फैट पे तो काम करना ही पड़ेगा, साथ में लिवर के लिए भी कुछ एडिशनल चीजें सोचनी पड़ेंगी, और ऐसे पेशेंट्स में रिस्क ऑफ डेथ ज्यादा होता है। तो बहुत अच्छा टेस्ट है, मैं कहूँगा ये हम लोगों का फैटी लिवर वाले मरीज में आजकल स्टेथोस्कोप हो गया है। जैसे डॉक्टर के पास जाते हैं सांस के लिए और वो स्टेथोस्कोप लगा के देखता है, वैसे लिवर के लिए फाइब्रोस्कैन है। तो लिवर फाइब्रोस्कैन के लिए एक और स्लाइड, ये इसमें हम दो वैल्यूज आती हैं हमारे पास, एक एलएसएम और एक विच इज लिवर स्टिफनेस मेजर, और एक कैप विच इज कंट्रोल्ड एटेन्यूएशन पैरामीटर। तो कैप हमें बताता है कि फैट कितना है, और एलएसएम बताता है कि फाइब्रोसिस कितनी है। फाइब्रोसिस मतलब हार्डनेस कितना है। एमआरआई के जरिए भी हम ये पता लगा सकते हैं। एमआरआई पीबीएफएफ is a test. Actually, it is a gold standard test. It can detect fat as well as fibrosis. It can detect fat uh, uh, quantitatively more than 1% in all, but it is not widely available. It is extremely costly, so it is not widely used present. And liver biopsy is the gold standard, where you uh, take a small piece of liver tissue, which is sent for pathological examination, and it gives you the best answer if there is liver fibrosis. So liver hard हो गया है कि नहीं हो गया है, लिवर पे इंजरी कितनी चल रही है, और कोई और बीमारी तो नहीं है। फाइब्रोस्कैन के बाद से अब हम इसका इस्तेमाल कम करते हैं। अगर कोई और डिफरेंशियल डायग्नोसिस, जैसे लिवर कमजोर हो रहा है और फैट के अलावा कुछ और भी लगता है, कुछ हो सकता है, चाहे वो ऑटोइम्यून हेपेटाइटिस हो, चाहे विल्सन्स हो, चाहे चाहे ड्रग इंड्यूस्ड हो, जहाँ कंफ्यूजन हो कि लिवर में कुछ और तो नहीं चल रहा, वहां पे इसको इस्तेमाल करते हैं। So this is how fatty liver progresses. So NAFLD is just presence of fat in the liver. So if there is isolated fatty liver without any inflammation, then chances of this developing into cirrhosis is less. But still, these patients would have increased chances of developing heart-related diseases and cancers. If there is mild inflammation, then these patients can definitely go to steatohepatitis also. And in steatohepatitis, there is increased risk of death compared to general population. And this death is not just liver related, it is cardiovascular, malignancy is cancers, and liver related. If there is fibrosis also, then the liver prognosis is poor, and such patients do poorly on liver parameters. Around 25% of overall fatty liver patients will develop NASH. Those who develop NASH over variable periods, around 15 years, would develop cirrhosis. And once a patient develops cirrhosis, he is likely to decompensate, which is liver failure, over coming 7 to 10 years. And a subset of these patients will develop cancers also. So around 1/4 of overall adult population in the world has fatty liver, and 1/4 of those who have fatty liver, which is a huge number by any standards, are likely to develop fat-related inflammation, scarring, which may progress to cirrhosis, liver failure, and cancers. So can we do something for it? Definitely. So for all who have fatty liver and have not developed advanced disease, it is the progression is preventable, and to some extent it is also reversible. So we need to act before it is too late. And unfortunately, advanced NASH or cirrhosis is not reversible. So what we need to do? So we need to have a lifestyle modification. The diet, the exercise, and the modification. These are the benchmark of managing early fatty liver, which majority of individuals would have. There are some promising medications already available and likely to be available in near future also. But unfortunately, the best answers to date are diet, exercise, and lifestyle modification. In my experience, individuals who do this, they have the best results, irrespective of the medication they have been taking. First, control your weight. So, weight loss is the benchmark of managing this problem. And for weight loss, we would need a hypocaloric diet. When we say hypocaloric diet, we say जितना कैलोरी रिक्वायरमेंट है उसमें कम से कम 600 से 800 किलो कैलोरी का डेफिसिट क्रिएट करना पड़ेगा. एक डाइटिशियन के कांटेक्ट में जाएं और एक बैलेंस्ड हाइपोकैलोरिक डाइट लें. अपनी डाइट में से प्रोटीन ना कम करें. डोंट स्किप योर मील्स एंड उसके साथ में मॉडरेट इंटेंसिटी एक्सरसाइज ऐड करें. समथिंग इज बेटर देन नथिंग. सो कोशिश करना पहली शुरुआत है. उस पर अगर 3 से 5% वजन कम होता है तो वो लिवर के फैट को कम करना शुरू कर देती है. और अगर 10% तक वजन कम किया जाए तो जो हमें बायोप्सी में नैश, जो सूजन और टू सम एक्सटेंट जो फाइब्रोसिस दिखनी शुरू हो गई थी, उसका भी रिवर्सल पॉसिबल है. ये डेटा किसी भी प्रेजेंट अवेलेबल दवाई के मुकाबले बेहतर है. तो जैसा हमने कहा, अगर 3% से ज्यादा वजन कम होता है तो लिवर का फैट कंटेंट कम होना शुरू हो जाता है. 5 से 7% पे सूजन कम हो जाती है. और 10% के ऊपर तो फाइब्रोसिस, यानी जो लिवर हार्ड होना शुरू हो गया था, वो भी रिवर्स कर जाता है. एंड दिस इज फैंटास्टिक रिजल्ट एज आई विल से. सो what should be the diet for healthy liver? The first important thing which we need to understand is, apart from what you take, the overall calorie, as we just mentioned in the previous slide, is most important. So hypocaloric diet is very important. Total amount of calories should be less. Now, I'm showing here Mediterranean diet, which is a very healthy diet. Suppose you start taking this, but your overall calorie intake is still high, then it is not going to help us. Definitely, if we want to have a healthy liver, or for that matter, healthy heart also, then our base should have a meal around vegetables, fruits, whole wheat and grains, beans, nuts, legumes, seeds, herbs, and spices. Juices should be avoided at all costs. Lots of either fresh juice or packaged juices are not good. Fish and seafood can be taken in twice a week. And dairy should be in moderate portions only. So poultry, eggs, cheese, and yogurt should be in moderate portions only. And red meats and sweets are best avoided. Exercises. So again, anything is better than nothing. This is the first concept. The second is, there are two forms of exercises. Aerobic exercises, जो हम दौड़ते हैं, walk करते हैं, swim करें, ये aerobic exercises हैं. They are very good for your heart health. They also help in maintaining weight. They would not lead to weight loss. They would reduce liver fat to some extent. So weight loss would come from diet, and then exercise would help you maintain that weight. They would be good for your heart and hence help in improving your overall health parameters. Then there is resistance exercises. चाहे आप योगा के माध्यम से करें, weights के साथ जिम में करें, या सेल्फ वेट के साथ घर पे करें. तो रेजिस्टेंस एक्सरसाइजेस हमारी मसल्स को बनाती हैं, मसल मास बनाती हैं, और ये इंप्रूव करेंगे हमारे लिवर के इन्फ्लेमेशन को, हमारे मेटाबॉलिक सिंड्रोम, जो ग्लूकोज एब्जॉर्प्शन, इंसुलिन सेंसिटिविटी वगैरह है, इसको मेटाबॉलिक पैरामीटर्स एंड लेस एनर्जी कंजम्पशन भी इससे होगा. सो कॉम्बिनेशन ऑफ बोथ एरोबिक एंड रेजिस्टेंस इज ऑलवेज बेटर. After this comes develop an exercise routine and stick to it. Get enough sleep, get enough vitamins and minerals. So when you start on a hypocaloric diet, uh, concept should be that it should also be a balanced diet. You should not miss on proteins, vitamins, or minerals. If you are doing so, supplements would be needed. Regular medical checkups, because this disease is not something which would give you symptoms initially. So anybody who is obese, overweight, diabetes, hypertension, significant alcohol intake, or family history of heart disease, diabetes, or liver disease should get medical checkups starting in their 30s to some extent, and maybe in 20s also if the overall risk factors are high. Eat small and frequent meals. Do not skip meals, and definitely lower your sugar intakes. Now, there are some medications also available for treating advanced fatty liver. So, if there is fatty liver with some inflammation, etc., then pioglitazone, saroglitazar, and vitamin E can be used. So, what are the tips to prevent fatty liver disease? And when we say fatty liver disease, this would include both fatty liver and NASH. Limit intake of saturated fats and trans fats. Eat a balanced diet. Limit consumption of refined carbohydrates, just maide wali bread, etc. Maintain a healthy weight. Chase your weight. Quit smoking. This would not directly improve your fatty liver, but an individual of fatty liver who continues to use tobacco in any form, tobacco, khani, zarda, bidi, cigarette, is more likely to develop cancers of liver or cancers elsewhere. Exercise regularly, limit or avoid alcohol, and take medications as prescribed. Thank you.
So, sir, we have some questions from the audience.
Definitely.
Yeah. So, there is one question that, is there any cure for fatty liver?
So it is an interesting question. So we need to understand fatty liver is reversible. It depends on our lifestyle modification which we can achieve. And in majority of individuals, if proper lifestyle modification is done, which is decrease your calories, exercise regularly, eat healthy, avoid alcohol, and yes, fatty liver would reverse, and a long healthy life would be possible. And when fatty liver reverse, or when you do all these things, it not only improves your liver health, it improves your heart health and decreases chances of cancers also. This is a healthy liver. Unfortunately, fatty liver has gone on to a situation of advanced NASH or cirrhosis. At that situation, it would not be reversible.
Yeah, thank you so much, sir. We have one more question, that when to visit a doctor and what are the symptoms?
So symptoms would come only late. There are no symptoms of fatty liver. Fatty liver does not produce symptoms. It is only when the liver damage is advanced that individual would have probably pain in right upper abdomen, jaundice, swelling feet, fluid in abdomen, bleeding, etc. What I would say is, if you have risk factors for developing fatty liver, risk factors are obesity, yani ki motapa, sugar, blood pressure, intake of alcohol, sedentary lifestyle, or family history. There is history of liver-related deaths in your family, parents or brothers and sisters. You should get yourself routine health check done. If your routine health checkup is showing fat in the liver on ultrasound, or your routine health check is showing SGPT, or which is also known as ALT, levels of more than 40 repeatedly, these individuals should definitely see a doctor for evaluation, whether something else needs to be done, as well as taking help in the form of what kind of lifestyle would help them.
Right. Thank you so much, sir. So on the behalf of Nash 24/7, I thank Dr. Vibhu Mittal for this lively and informative talk. So as you have been emphasizing the awareness for liver health and disease, sir, I think it is equally important for people affected by fatty liver to regularly visit doctors and continue medications. With
Definitely.
careful observation and precautions, it is possible to obtain control on the disease. This is what I can conclude from your discussion.
Definitely.
And I would also like to thank my audience for this active participation and patience in their making this event successful. Stay connected with Nash 24/7 on Facebook and take care of yourself and your family members. Thank you. Thank you so much, sir.
Thank you.